Hi, my name is Anand Patel. I am at the University of Chicago, and I'm part of the Acute Leukemia and Myeloid Malignancy program there. Today, I'm going to be highlighting a trial and progress that we have for patients with accelerated and blast phase myeloproliferative neoplasms. So to give some background, MPNs have a variable risk of progressing to a more aggressive blood cancer called acute leukemia. This is commonly called accelerated or blast phase MPNs. And what we know is that typical therapies for acute leukemia don't work very well when this happens for patients. With this in mind, we have designed a study that'll be looking at oral decitabine, which is a standard drug used for the management of accelerated and blast phase MPNs, combined with a novel drug called iadademstat, which is an LSD1 inhibitor. Both drugs are oral, and what we are looking at is whether the addition of iadademstat to standard therapy can improve remission rates in patients with accelerated and blast phase MPNs. This study will begin with what we call a dose escalation phase, so where we try to find the right dose of iadademstat to use in combination with oral decitabine. After that portion is complete, we will then proceed to what's called the randomized portion of the study. So that's where half of the patients enrolled will receive standard therapy with oral decitabine, half of patients enrolled will receive the oral decitabine combined with iadademstat, and then we will compare these two groups and see if remission rates are truly better in patients that receive both drugs versus the one standard drug. This is very exciting because there's never been a randomized study for accelerated and blast phase MPNs before, and we know that there is a very high need for looking at novel therapies in this patient population.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.